Hi everyone, our lecture today is about mental and incisive nerve block. As you know, the mental nerve is a terminal branch of the inferior alveolar nerve. It exits through the mental foramen and divided into three branches, as you can see in this picture. One branch supplies the skin of the chin, while the two other branches supply the skin and mucous membrane of the lower lip. You have to know the anatomy of the mental nerve in order to know the area which it supplies. As you can see in this picture, this is the mandibular canal and this is the inferior alveolar nerve. The continuation of the mandibular canal anteriorly is the incisive canal which contains the incisive nerve. Also you can see this is the mental foramen and this is the mental nerve. The inferior alveolar neurovascular bundle divided at the premolars area into two terminal branches. The first is the mental branch and the second is the incisive branch. The mental branch provides anesthesia to the soft tissue only, while the incisive branch supplies the anterior teeth. There is also a common mistake in our clinical practice. When we want to give anesthesia to the mandibular premolars, we said give mental nerve block, but this is not the accurate name. The accurate name is the mental and incisive nerve block technique, because mental nerve block technique only provide anesthesia to the soft tissue interior to the mental foramen, including the chin and the lower lip. The indications for mental nerve block technique, including if we have biopsy of the soft tissue interior to the mental foramen, also in cases of laceration to the lower lip, and in some periodontal surgeries. Also, you can see this is the mental nerve. The mental nerve block technique only provide anesthesia to the soft tissue interior to the mental foramen. Now we have the mental and incisive nerve block technique. This technique provides anesthesia to both mental nerve and incisive nerve. So it provides anesthesia to both soft tissue interior to the mental foramen and also in addition to the teeth, including the anterior teeth, premolars and incisors. So the mental and incisive nerve block technique could be used as an alternative technique to the inferior alveolar nerve block in providing anesthesia to the mandibular premolars. The mandibular premolars getting their innervation either through undivided mandibular nerve or through the incisive nerve. Now we have the steps for this technique. First, you have to locate the mental foramen by palpation. The patient will feel some soreness while you palpate the mental foramen. Also, you can use the X-ray or radiographical examination to locate this foramen. As you can see, this is the mental foramen and this is the OBG which demonstrates the position of the mental foramen. Usually the location of the mental foramen located between two premolars or at the second premolar, but the position of this foramen differs between individuals. After you locate the mental foramen, they retract the cheek and lip and insert the needle at the depth of the mucosa, at the depth of the mucobuccal fold. Then guide the needle for a short distance for about 5 to 6 mm toward the mental foramen. Then inject the anesthetic solution slowly to avoid pain to the patient. At the finishing of this procedure, you have to make some massage to the area in order to guide the anesthetic solution toward the mental canal and to aid in providing anesthesia to the incisive nerve. Thank you all for your listening, and these are some references for our lecture.